Hello, everyone, and welcome. Very excited to have everyone in attendance. Thank you so much for joining us today. My name is Aidan Dowling, and my pronouns are he, him. I am the co-founder and chief advancement officer here at Point of Pride, and we're excited to have you with us for this very special conversation, which is part and the kickoff of our Transgender Awareness Week programming. This week is really all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're very grateful to have everyone here as part of this important dialogue. Before we begin, I do want to introduce any of those who may not know what Point of Pride is or what we do. So Point of Pride was founded in 2016, and we are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our electrolysis support fund, and our currently open for applications annual surgery fund. If you want to know what our mission is, that is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to the services they need to live authentically and thrive. So as you can see to my left here, I'd like to introduce our guest for today's virtual workshop. So everyone do a virtual wave hello to Dr. Zara Ley. Pronouns are she, her, they. Dr. Zara is a board-certified plastic surgeon who's recognized expert with vast experience and knowledge in all aspects of transgender and gender-diverse surgical care. She is the only transgender woman of color to offer a full spectrum specialization in gender-affirming surgery, including top surgery, bottom surgery, facial surgery, and body contouring. Prior to joining the team at the Gender Confirmation Center in 2022, she worked as an assistant clinical instructor of plastic surgery at the University of Utah and had her own private practice in Arizona. So as I was told earlier, I should refer to you as Zara. So hello, Zara, welcome, and thank you for being here to spread your expertise for this bottom surgery fireside chat.
Of course, thank you for hosting me.
Of course, excited to have you. So as a reminder to everyone here, we have time for questions at the end of this discussion. And for those of you who asked questions ahead of time, we did take some of those into account and put them into our chat box. We have Abby, who is here for Point of Pride, to be answering some of those questions ahead of time if she is able to. And then, of course, we have some interpreters here. So thank you to both of you also for coming, Wyna and Mackenzie. I hope I pronounced your name correctly. Please correct me if I did not. Awesome. So
Wanye.
Wanye, there we go.
Yeah.
Thank you. And thank you for interrupting
No
me.
worries.
I appreciate that. Too
No
many
worries.
people let it go. So thank you. Okay, awesome. So our subject overview. So just really want to remind people why we're here and what we're going to talk about and what is transgender bottom surgery. So this fireside chat is going to focus on transgender bottom surgery, both FTM, so female to male, and MTF, so male to female procedures. So bottom surgery is a vital gender-affirming option for many transgender individuals, helping align their bodies with their gender identity and alleviate gender dysphoria. FTM surgeries often include procedures like phalloplasty and metoidioplasty, while MTF surgeries typically involve I always pronounce this wrong, Dr. Zara. Can you help me? Vaginoplasty, is that it?
Yeah, that's right.
Oh, okay.
Vaginoplasty, or vulvoplasty.
There we go. Vulvoplasty. I always put an A. I don't know. I'm pronouncing it incorrectly. So these surgeries can significantly improve mental well-being, self-esteem, and quality of life, though the journey is deeply personal and complex. So Thank you again, as I mentioned, Dr. Zara, for being here. And overall, just wanted to give you an opportunity to start off with answering the question of like what first inspired you to specialize in gender affirming surgeries. I think that you have such a unique story being a trans person yourself. Would love to just hear a little bit about that backstory of what got you here today.
Um, yeah, well, let me just say for those who are taking time to join us in this chat, thank you for setting aside the time to listen to us. But the answer to that is um, pretty interesting, and I couldn't answer it without sharing some of my own experiences as I basically came out and started going through that journey of becoming my true self. And so, um, as a surgeon, I was going through all the different portions of my training. And what I now find very interesting is that in none of it, of course, things are different now. So I'm much older than I seem, but back in the day, right, like an old person, back in my day, um, there was literally zero mention or training of anything related to gender healthcare. Um, there was one chapter in one of the plastic surgery texts that had gender surgery care in it. And so I would flip through it and just be amazed at all of this. I actually learned a lot from YouTubers and websites as I was closeted and just trying to get information on um, what was happening to me, what was going on, things about hormones, things about people's journeys. And I'm very grateful, even today, to the YouTubers that were brave enough to put their stories out there, because it really helped me as a person to finally get the courage to basically just become me. And as we all know, those in the community who choose to go through this, in terms of like for me, surgery was the right thing for me. So it really helped me to see what the changes were and what the possibilities were. But during that time, I thought to myself, like, how do I get training in this? And there weren't that many centers. Certainly, again, back then, there weren't official gender surgery fellowships. These are extra years that doctors tack on to their already long training in order to specialize in something. That's what a fellowship is. And there weren't any until recently, actually, for gender care. And so I was thinking, where'd I go? Should I go to Thailand, which was very well known for gender surgery? And then there's also Belgium. But I couldn't possibly take the time off in my long educational and training career to do that. Plus, my own journey was moving much faster than that. I couldn't wait for me to finish to go ahead and do that. So the short of it, I'm sorry, it's a long answer.
Fine. That's what
Basically,
we're here. We're here
but
to hear you.
basically, I'll make it short. Basically, as I was seeking to have bottom surgery in particular, now everybody knows what my bottom is. um, I went to Dr. Meltzer in Arizona, and of course, I did my research. I looked through everything, and I had seen his name and had known about him much sooner than that. And so, on my consultation for my bottom surgery, I never, in the whole process, I never pulled my doctor card like, I'm a doctor. I should get special privileges and get a sooner appointment or, anything like that. I just went in as Zara, as myself. Um, and as we started the consultation, he just, he wanted to like get to know me. And so he asked, like, what do you do? And I'm like, I'm a plastic surgeon in Tucson, which is 100 miles away from where he was practicing. And you should have seen his face. He was like, what? Like, that's amazing. And then he got really excited and started asking me like, like where did you train? And I listed the million things I've done in terms of my training. And by the end of the consultation, he literally offered me a job.
Oh, wow.
Said, I'll
You're
train
getting
you.
a
And
surgeon
then,
and a job.
yeah, that's right. I basically, I came out of that, with the promise of a vagina and a job. So um,
I love it.
that was fantastic. And my friend and I, came away and we were driving back to Tucson. And I was like, did he just offer me a job? And she's like, yeah, I think he just did. And it was the weirdest thing, right? Because all I wanted was surgery. And if he hadn't brought it up, I would have just been like, like, I don't care. Like, I want my surgery. And I would have gone on and done my own life. But basically, he trained me. So it's, you know, and I thought about it, and I thought, how cool would it be for someone like me to go through it and then be able to train and then be able to offer this to others. And so that's what's special to me about this job. I didn't dislike my job before, but this was like 100 times, 1,000 times more deeply satisfying
Mm,
um, than anything I had done before. And I still feel that. I still feel um, that it's very special. In my position as one of the very rare trans persons dedicating our surgical career to this, that it's just wonderful. It makes me super happy to be able to do that.
I love that. And I think it's very aspirational for those sitting, you know, in in the chair right across from you, so to speak, right? The this metaphorical chair, to be able to see someone like you in that position, right? Being a surgeon, having gone through your own process. I think it's really awesome and inspiring. And I think that I'm sure that you've not just physically changed people's lives, but emotionally as well, and the possibilities. So I love that. I love hearing that story. Thank you so much for sharing it. So I know that you had mentioned that for you, surgery was something you wanted to do. And, one of the questions we have is, what advice do you give to patients struggling with the decision of whether bottom surgery is the right step for them?
People do ask me that, and I of course hear um, many different angles and feelings and fears about proceeding with surgery. But ultimately, yes, I know I'm a surgeon. Um, I don't. I really don't push people one way or another. I really want each individual to make that decision for themselves. Um, and of course, there's always other things at play, right? It's never an isolated thing. Um, and so I certainly don't try to pressure patients into any surgery, but even within any set of surgeries, such as, body stuff or facial stuff, where there typically is more than one procedure, I'm not trying to like sell them on everything, right? I'm not a used car salesman. I don't. Yes, this is how I make a living, but I'm also not like trying to take advantage of people and tell them like this is what you need to pass or this is what you need. Um, and there's no other way. And as a surgeon, I feel like our community um, is definitely a vulnerable community. I'm in that community, and I know I'm still vulnerable to a lot of things. You wouldn't think so, but I am. Um, but I feel like there are certain places, um, which I frown on, that sort of prey on that, and take advantage of our community. So you have
Yeah.
to make that decision for yourself, and don't get pressured into things that uh, you don't necessarily want. Because I do see it. I hear people go to certain places. Most places are fine. But certain places they really just want to do as many surgeries, for the sake of financial gain. So um, but that's basically it. I do say it sometimes where I'm like, I literally say I'm not a car salesman. I'm not here to tell you that you need this or need that, or if you choose this part of it, you also have to have this other part. I do staging and things, but I never say like you have to come back to me for the stage. This is a contract. It's not like that. And I do also bring up other options of things that I don't do in terms of that technique. And I will do my best to refer patients to the places that they need. Um, but yeah, I really just try not to like force my own personal opinion on anyone.
I love that. Do you have any sounds like a warning sign is if you go in for one thing and you come out with four things.
Well, that's not necessarily wrong because sometimes patients aren't sure about other things, and so they'll be like, especially something like facial surgery,
Mhm.
they may not like their jawline or their forehead, but then they're also not really sure, um, what else could be done. And so if they ask, then I systematically go through, the options.
Mhm.
Again, with the sort of disclaimer that, okay, I'm going to mention a bunch of things. This is how I see it as a surgeon, um, but that you're not obligated to be like, oh my gosh, I need to get this. Um, it's just, educational and certainly, of course, my professional opinion on whatever it is, whether it's bottom, whether it's body contouring and whatnot.
Is it possible to do more than one surgery at a time? For instance, if someone wanted to get stage one of phalloplasty and body contouring or any other combination, or do you suggest doing one surgery at a time?
I don't. It is very possible to combine several surgeries or sets of surgeries. There is a time limit that is considered like safe for surgery. And the hospital or surgery centers have these um, sort of rules of, I think it's like, it depends on the center, but 9 to 10 hours is about as much surgery as you can do on someone, and that's what they allow you to schedule. Now, of course, if there's a complication, not necessarily a complication, but maybe it took a little bit longer because of some unforeseen anatomical thing or something, and it goes over, then fine, that's okay. Um, but yeah, the it's also very personal how many things you want to combine, like face surgery with breast or face with bottom. And if it's a lot of things and they want to have it combined as close to each other as possible, I can do head to toe, um, depending on what the procedures are. Um, 2 days of surgery, 2 days apart.
Wow,
It's
that's
a
a
lot,
lot.
and it's not for everybody. I certainly didn't go through. I've had head to toe surgery, and I certainly didn't break it up that way. But again, it's about education, right? Telling folks like, okay, if you combine it, yes, it's a huge hit. For one, you have to obviously qualify for it. You're healthy, you don't have a lot of comorbidities, or things that one would worry about, your health and your safety. But if you're pretty healthy and you feel like you're pretty strong, you can get through it. And many people do that way. It's one anesthetic, one sort of relatively short period of recovery, right? 2 days apart, some very acute recovery during a short period of time. But then you're mostly done or completely done, rather than, sure, you can take any set of procedures and break it up into 6 or 8 procedures, but then it's 8 anesthetics, you know, 8 recoveries, um, and then more time.
Yeah. When it
So
comes,
very personal.
yeah. Um, Thank you. When it comes to like what are the most common that you find when it comes to male to female bottom surgeries and then female to male bottom surgeries?
For the trans femme individuals, um, face and bottom is pretty common, or face and breast is pretty common. And of course, breast with bottom is also very, very common. Um, for the masculine patients, the set of surgeries and the combinations tend to be more limited. It's very rare for me to do facial work, although that is available. So it's typically body contouring and um, bottom surgery. And of course, there's top surgery. Um, so you can combine top surgery with something like a simple metoidoplasty. Um, Body contouring is a bit different because it usually means liposuction. And if I'm doing bottom stuff, um, there seems to be, like, sometimes, again, depending on exactly what procedure, too much swelling that will pool down to the, gravity wins. So that pools down to like the groin area. And so you don't want to do that. Work on some big liposuction thing, and then worry about how your metoidoplasty is going to heal, with all that swelling from the surgery itself, but also the swelling and the pooling down to the groin area.
Is there any words of advice you could give to all of those listening and participating today to uh, just about the expectation management of the outcomes, whether that is related to how long after a bottom surgery or a stage of bottom surgery, or even just functionality, kind of if you could take a minute or two to kind of help people with their expectation management, I think that would be a great benefit.
Yeah. So expectations. You mentioned a lot of facets of expectation, right? So there is certainly, the aesthetic facet, and then the functional facet and recovery facet. Specifically for uh, fem patients, the dilation portion, if that's something that they're going to have to do. Um, and so it really is through education. Certainly, office paperwork can cover a lot more than in one or two, like, consultation sessions. I try to be pretty well-rounded in terms of my consultation, with covering all those things, um, but also being pretty transparent about what my complication rates are. Um, for each set of procedures, so that the patients can truly be well informed in the process.
How when you think of, I think a lot of people think about aesthetic and functionality when it comes to bottom surgery. Could you speak a little bit about the realism that could come with a bottom surgery for a trans femme and the bottom surgery for a trans masc? And then could you um, talk a little bit about the functionality between both?
Yeah. Um, so gender surgeons, including myself, our goal is to obviously do our best to create through surgery, um, the basically set of genitals, right? Speaking of bottom surgery, the set of genitals that best fits the patient's wishes. And so um, for those that either want um, female basically genitalia or male genitalia, but we also have to remember that even within those two groups, there's the in between, the gender neutral, non-binary gender neutral options as well. And so based on um, my experience and through education and going through different professional meetings regarding this, you know, I feel like I certainly have a pretty good idea of what is achievable. Um, and so what I can say is that in terms of appearance, again, depending on the procedure, let's say vaginoplasties, the vulvas that we create um, are actually pretty darn good, I have to say. They're pretty darn good, functionality wise. Um, if everything is healing okay and patients do follow all the recovery and dilation um, requirements and they heal well, in the long term, they also have to maintain it. But in the long term, it's quite functional. Sensation uh, should be intact, and it is in the vast majority of patients. The functionality of the vaginal canal is also good, but that is heavily dependent on the patient dilating, certainly initially, and eventually using it can also play a role in the maintenance of it. Now for the mask patients, again, whether it's an actual phalloplasty or just a metoidoplasty, there are differences in the success rates of sensation, and I do bring that um, up during the consultation. Metoidoplasty, none of the nerves that go to the glands of the phallus are altered in any way. So full sensation in those cases. Whereas for the phalloplasty portion, it depends on what phalloplasty option they're going for and whether that option carries a nerve that can be connected to an erogenous nerve, basically a clitoral nerve, through microsurgery. That I have to admit isn't perfect. And the success rate is much more variable than, like I said, a metoidoplasty where the nerves aren't touched, so it's just as good as it was before.
Right, right. Awesome. I think that will give a lot of clarity for some folks who are here today. Awesome. So as
Things
a,
to bring up though, that's the thing,
yeah, yeah, go ahead.
to sorry. Things to bring up with your surgeon, whoever you go to, clarify, um, that kind of thing. Be well informed.
Where would you say, besides places like, what we're hosting today, and where would you say is a good place to go or places to go to get some more information about any of the bottom surgery options that someone may be interested in?
Um, yeah, so again, um, the way I did it was YouTube. Now, um, you can certainly get a lot of information on YouTube, but you can also get um not necessarily intentionally misinformed, but sometimes some of the stuff there isn't as accurate or as true. Um, so be careful with that, but it's at least an easy starting point. The other way to do it is, um, look regionally or locally, like who are the gender providers? Look at their websites because most of us um, have information posted on our website about all the different procedures and some pretty basic things to expect. Um, and that's another way to find out that that is certainly much more accurate information. Academic centers and private centers is another place to go. The other place that is also very popular is Reddit, but just like YouTube, you have to be careful about some of the stuff. But overall, I think it is pretty informational. And any sort of questions or doubts, obviously, bring them up with the actual provider, um, and ask them about that and have them clear up, whatever that is. Um,
Is there a question that you kind of wish people asked you more often when they were getting a consultation with you?
some patients do ask me that, they ask their questions and then they say, is there something I didn't know to ask, um, but that I should? Um, and depending on what it is, I kind of bring it up, but I guess there really isn't one. The biggest one that I think patients should ask is the particular surgeon's experience in whatever procedure it is. And don't be embarrassed to be like, well, what complications have you had and how did you handle it? What are your actual numbers and not just quote some paper of like, well, this paper says the complication rate is, I don't know, 5% you know, for whatever the complication is. Um, but the actual surgeon's rate is 10%, then that's kind of deceiving.
Mm, right,
Right.
right.
So I think that's important is to know who you're going with and what their rates of things are. And hopefully they're truthful and accurate about what their experience has been as a surgeon providing this.
Awesome. Thanks so much. So I know that we have a Q&A section of today's talk. So for everybody who has been listening, as just a quick reminder, you can drop the questions into the Q&A. If there's anybody that would like to potentially come up and ask, you can be unmuted. No pressure, just more of a if I have if you'd like to, you can let us know when you answer the question. But before we jump into that, oh, and you can also upvote a question. So if you maybe see a question that you are like, actually, I do want to know the answer to this, you can just click the little thumbs up button on the left-hand corner of that question, and that will bring it to our awareness. Before we begin questions, however, though, if you do feel inspired by today's conversation, we do encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like bottom surgery, binders, gaffs, HRT, and HRT access, as well as electrolysis and laser hair removal to trans individuals in need. So donations can be made at the link. Abby will drop that in the chat, or you can also text the word trans futures to 44321, and every contribution makes a big difference. So thank you so much. So we are going to move on to some questions. So I'm going to start, Zara, with just the ones that have the most thumbs up. So I'm just going to start on this first one from Santiago. It says, can you elaborate on the pros and cons of rod versus pump? Thank you. I'm assuming they're talking about phalloplasty, if I'm
It's it sounds that way. That is a good question. I think Santiago is referring to erectile devices for someone who has had or is considering having a um, phalloplasty. Now, currently, only those with a phalloplasty with a flap, as opposed to a metoidoplasty, um, can have these erectile devices done. And so the rod is basically just what it sounds like. There's malleable rods, but there's also firmer type of rods that you can place within the penis in order to make them stiff enough to allow for penetration for sexual purposes. The pumps, the pumps are um, devices that require pumping fluid into a chamber, typically um, in order to inflate and make the device hard, for the same purpose. I personally use hydraulic devices, so pumps that use saline as the sort of the filling agent. Um, the pros of uh, the rods is that it doesn't depend on, you can't have like the mechanism fail, like the pump or the tubing or a leak, because it's a solid device. The downside of a rod is that one of the criticisms is that sometimes it can't basically fold down enough so that there's always a bit too much of a bulge in the crotch, right? It's one thing to have sort of the male sort of bulge there, but when it's not, it can be hard to conceal, and patients can be feel self-conscious or think that people think that they're perverts, kind of thing, and that's a real sort of concern. And then with a pump, like I said, it can malfunction, um, which then requires to have to replace it. Uh,
awesome. Thanks so much.
that's brief. It's much more complicated than that, but yes.
I'm sure, right? Like we could probably be here all day. So this is another one. This got a couple of upvotes as well. So let's see. So it says from Anonymous. So it says, do you have any tips for establishing or maintaining health neovaginal microbiome? Like what to expect, what to avoid doing?
That's a good question. So, once you have had a vaginoplasty, I think part of it also depends on what type of vaginoplasty lining you have had. So very briefly, I do skin lined vaginoplasties. There's peritoneal lining vaginoplasties. There's tunica vaginalis vaginoplasties. And of course, there are the intestinal options, whether it's a portion of the colon or uh, small bowel options as well. Um, the non-intestinal options, um, I think that in general, having one myself, it kind of takes care of itself. And so I do think that um, frequent douching um, is important in maintaining the natural flora or the bacteria that builds up in the vagina of peritoneum, skin, or tunica options. Um, I think that's helpful. And of course, being aware of things that can happen. So our vaginas that are non-intestinal can get yeast infections. You can get bacterial infections in there. And of course, for those, you need medications, no differently than any cis vagina having the same issues. Intestinal uh, issues, of course, it's intestine, right? So the intestine will come with its own set of uh, bacteria. But I think the need for, say, douching is less because the intestinal mucosa does sort of shed, and it's kind of, in a way, self-cleaning, like, um, natural vaginal lining does as well. But you can still get infections in there as well, only because it's been basically separated and detached from the main gut system.
So many words I could never pronounce if I had to read them. So I'm so happy you know. Thank you so much. So this other one, okay, so this question is also anonymous. So it says, if you get a minimal depth vulvoplasty, is it possible to then get vaginoplasty with a canal at a later date?
Very good question. And that is a point that I do bring up to patients who come in asking for a vulvoplasty. Again, I don't try to push people, you know, from one to the other. And so if they come in and they ask for vulvoplasty, that is a point I do bring up. And the answer is yes. Going back to the misinformation, um, there's a bit of misinformation going around that you can't. Once you choose a vulvoplasty, like that's it, you can never have a vaginal canal, and that's simply not true. Yes, you can still have one, and the options for building the new vagina, you can still have a skin-lined vagina. Of course, the skin now would have to come from, for me, someone who's had it a vulvoplasty, all the excess skin has already been basically used up and tossed. And so I take skin from the groin crease, hip area, and I can still make a vagina. Um, of course, peritoneal lining is totally an option for someone who had a vulvoplasty. The only one that gets eliminated is a tunica vaginalis, which is part of like the scrotal kind of tissue that wraps around the spermatic cord and the testicle that has basically been destroyed in performing the vulvoplasty. So you can't go back and say, hey, I want tunica as my lining. Um, so yeah, the answer is yes. And then the other thing I bring up, aside from yes, you can still have it done, is the risk of making the canal is the same as any first timer. This is not the same thing as a redo surgery. A
Mm,
redo surgery carries much, much higher risk
mm.
of significant complications.
Thank you. This question says, does size in phalloplasty play a factor in sensation?
It certainly does. And even in phalloplasty, for me, it's anywhere between usually 5 to 5.5 inches, whether it's a groin flap phalloplasty or a ALT or a radioform phalloplasty. I aim for about 5 to 6, but mostly 5 to 5.5 inches in length. And so when I put the nerves together, or put a nerve inside a phallus, the more tissue it has to grow through, you know, it's not usually 100% growth. And so the larger space it has to kind of grow through, obviously, it does carry a lower chance of full sensation. It could be patchier maybe, or a little bit less,
Hmm.
but it can lead to patients being orgasmic through their phallus.
Fantastic. Sorry, I'm looking through some of these to see which ones got upvoted so I can make sure that we get to the best ones because I do know we're coming at time. So, let's see. For vaginoplasty, do you often have requests for cosmetic revisions after the initial procedure?
I do. I get them from my own patients, and I get them from other centers around the world, actually. Um, and depending on what um, they consider being deficient in, um, there's many things that can be done, such as clitoral hood or clitoral column, um, and usually more commonly labia minora, the definition of the labia minora. But yeah, there are options to improve the aesthetic results.
Awesome. So I have, is there a good time in someone's life, like age-wise, to get any type of bottom surgery? Like, is it better in your 20s than in your 40s, or does it not really matter?
I don't think it really matters. Um, as long as you're healthy, right?
What about,
Statistically,
yeah, go ahead.
I mean, I've done surgery in 60 some year olds, like almost 70. Um, and yes, they obviously cleared the medical issues, but they do have more issues. Blood pressure, maybe some low-level kidney disease, that kind of thing. So, between 20 and 40, no, not really.
Okay, great.
Just be healthy. There's young people that aren't healthy, unfortunately, or have comorbidities, and it doesn't mean it's a no. It just means that we have to make sure that any person at whatever age is in you know good condition to proceed to have surgery and anesthesia, not just surgery, anesthesia safely.
I know the answer to this one, which is the first of all of the questions, but I want you to answer it. Is electrolysis required before a vaginoplasty?
It is not required. I highly recommend it. And there are patients that simply, because of their anatomy, their pelvic dimensions, just don't have enough of the tissue that I use anyway, especially since I'm one of the skin only surgeons. Um, in those cases, again, I go to the groin crease, hip area to take any additional skin that I need. And typically there isn't hair in those areas. And so they end up with basically no hair inside the vagina by doing it that way. Um, but otherwise, I highly recommend it because the last thing you want is a lot of hair inside the vagina. Now, a few hairs or even a little bit of hair is not an issue. I've only seen one patient, which wasn't even my patient, um, who had a severe, probably the worst I've ever seen, of hair inside the vagina. And I'm talking like full on hair inside in the shape of a vagina, right? So it's a closed space, and it was just full of hair. And as one can imagine, there were so many other things matted in there, um, that it was pretty bad. And all I could do at that point was to pluck out all the hair. Um, and it probably regrew, but it's very, very hard to find a laser person or a electrolysis person to have the right equipment and the willingness to do intravaginal
Mm,
hair removal. So I highly recommend it. I don't require it. I do thin the graft if it's a skin lined thing. Um, I do thin the graft so that most of the hair follicles are eliminated. If you choose peritoneum or tunica, there's zero hair, to be
yeah,
fair, or colon, obviously.
it sounds intense to have to get that taken care of. For all of those who are interested, we do have our electrolysis and laser hair removal fund opening in January. So if you are somebody who is in need of that in preparing for potentially a bottom surgery, you can definitely apply. Um, just a little shout out to you, Zara. It says not a question, but yay. I'm so happy you featured Zara. She is a real inspiration and idol for me, both surgically and personally. So wanted to give you
Yeah,
a little,
that's very sweet.
yeah, a little shout out there.
Any insults?
No, no insults, no insults here. So there are so many questions here we are not going to get to. So thank you everyone for your questions. We will answer this one next. So is it possible to have a phalloplasty after giving birth as an FTM individual? Thank you for your time and sharing your expertise with this community, which is
Yeah,
your
absolutely.
boom, done. Love it. Awesome. Well, all in all, thank you so much. I feel rude not calling you Dr. Zara.
I
I
told you this before. It's
I know, but it
it's
just
just that. Just fine. We're
so
within our community. It's a safe space.
yes. Well,
Um,
thank you.
and it's old convention, right? That's like
Well, I
I know
will.
I'm old, not that old.
Well, not that old. Well, thank you, Zara, for this awesome event. And again, thank you to everyone who asked questions. Thank you to everyone in attendance today. If you like to stay connected, we'll drop the information for GCC in the chat. We'll also have an event replay on our blog, which will also include some more information on how to get a hold of Zara, or if you're interested in getting any type of services. And every resource that we mentioned here today will be in that blog post. I also encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG, and subscribe to our newsletter to get information about those programs when they open for all of our applications. Again, if you are looking to get bottom surgery and you are somebody who has barriers to accessing care, our annual surgery fund is open right now. And if you are in the position to support our work through donations, you can make them in by texting trans futures to 44321. And before you all leave, I want to remind you of some other programming that we have continuing throughout the week. So tomorrow we will be hosting our gender affirming voice coaching workshop with Renee at 4:30 p.m. Eastern. To see all of our program for the week, you can check out our socials or our blog on pointofpride.org. Again, Zara, thank you so much for coming today. It was a pleasure having you. Thank you, everyone who attended, and happy Trans Awareness Week.
Thank you, everyone.